Kia ora koutou. Welcome to the ACE RMO 2025 South Canterbury Timaru Hospital webinar. My name is Sam and I am the ACE RMO consultant. Today we're going to start off with an opening karakia by Aaron, the RMO unit manager, and then I will give everyone just a brief outline of today's webinar.
Tēnā koutou katoa, e mihi nui ki te mana whenua o tēnei rohe. Ka te huri apa tēnā koe, tēnā kuru ki te mani uri o tēnei rā. No mai haere mai ki te tēnei hui no re rā, tēnā koutou, tēnā koutou, tēnā koutou katoa. Greetings to all, special greetings to the people of the district, greetings to our visitors today. Welcome to this meeting, greetings to you, greetings to us all.
Thanks to everyone for taking the time to join today's webinar. We'll move on to the panelist introduction shortly, just to provide you all with a quick brief outline of what you can expect. We will have a presentation that we will share with you, and that will be presented by our wonderful panelists and our RMO representatives, and they'll tell you a little bit more about their experience working at the hospital. Then towards the end of the webinar, there will be a live Q&A session, and then we will finally close off with a closing karakia. So just a reminder to everyone watching, all questions can be dropped in the Q&A box above. You can drop these questions into the box throughout the webinar, but just to note that these will only be answered towards the end of the session. So please, if you do have a burning question, now is the perfect time to ask those questions and our panelists can answer for you.
Kia ora, ko Aaron Bronchek toku ingoa. I'm Aaron Bronchek. I am the RMO unit manager at Timaru Hospital.
Kia ora, I'm Bodine. I'm a PGY2 currently here. I'm from Timaru, so I went to med school in Dunedin and came back here to work. I'm on my GP attachment at the moment.
Kia ora, I'm Kate. I'm the PGY1. I'm actually an Auckland graduate, not from the South Island at all. And so this was also my first time working here down south. I'm currently on 18R.
Great, thank you. Lovely to meet you. And again, really appreciate your time. So thanks for being here with us all today.
Right, so today I'm going to tell you a bit about the ACE application process and how it relates to Timaru Hospital. First, I'll just tell you a bit about Timaru Hospital and the service we provide as RMOs and for RMOs. So we're located on the South Island's east coast, about 2 hours between the tertiary centres of Christchurch and Dunedin. We've got 135 beds and a district population of 60,000. This population is spread across quite a large geographical area between the Rangitata and Waitaki River and out to the Southern Alps. We offer services in ED, geriatrics, general medicine, obstetrics and gynecology, orthopedics, pediatrics, psychiatry, and general surgery. Got an ED, 4 operating theatres, an ICU, and radiology, including CT and MRI on site. So as a house officer at Timaru Hospital, your experience is more hands-on than you would find at larger hospitals. There's more opportunity from teaching from consultants on the job. So what makes South Canterbury a great district to work in? As I mentioned earlier, you benefit from valuable hands-on experience working closely alongside your consultants. Due to our size, you become a truly valued member of the team. Our consultants will know you by name, as well as other clinical staff. You enjoy a healthy work-life balance and a supportive environment. You'll have greater opportunities to access clinical opportunities with only 14 registrars and a small cohort of medical students. Every rotation offers the chance to explore a diverse range of clinical scenarios and expand your experience, no matter what run you do. Why Timaru Hospital? We are well known for having a supportive management approach and being able to provide broad clinical service exposure. This is ideal for interns with strong clinical skills, teamwork, enthusiasm, and confidence to take on a significant responsibility. This is especially when there is less support around on after-hours shifts. Small hospital size means there's greater access to consultants and hands-on experience for teaching. Health officers regularly attend theatre sessions and are expected to assist consultants directly on surgical runs. We encourage you to visit us in person. It's a great opportunity to meet our team, ask any questions you have, and get a feel for our supportive environment. But during your visit, I'll arrange for you to connect with one of the current house officers who will give you a tour of the hospital and share their first-hand experience of what it's really like to work at Timaru Hospital. So my details are on the slide, otherwise the contact information is on the ACE website. I encourage you to visit before applications close in July. So what makes a successful ACE application at Timaru Hospital? So we don't conduct interviews here in Timaru, so your cover letter carries significant weight in the selection process. This is your chance to introduce yourself to me and the selection team and explain why you're drawn to Timaru, highlight your strengths that you bring to our medical team. With only a small cohort of RMOs, we seek candidates with strong academic performance and solid clinical competence, while also being able to demonstrate the following collaborative, team-oriented approach, confidence in your abilities balanced with awareness of your limitations, a clear understanding of the unique environment at Timaru Hospital, flexibility, resilience, and adaptability, being excellent at communication and having good interpersonal skills. We're also seeking a genuine desire to be part of our team and contribute meaningfully to our hospital community. So when we review your ACE applications, we consider the following factors, mainly your cover letter, CV, a personal statement, strong references with exceptional feedback, your ACE score, demonstrated clinical competence and academic performance. We also look at your connections to the region, whether that be community ties or family in the area. And again, we're looking to see a genuine interest in Timaru and the hospital community. So at Timaru Hospital, every application is reviewed by myself and the pre-vocational educational supervisors, who will be your supervisors in your first 2 years. Following that initial review, we rank all applications. This process is carried out with the clinical supervisors here, which are our SMOs, and also the Chief Medical Officer. So I'm looking forward to reading all your applications and wishing you all the best in the process.
This presentation will just talk a little bit about what it's like to work here in Timaru from Kate and I's perspective. So as Aaron said, we're located on the east coast of the South Island, about halfway between Dunedin and Christchurch. We're easy access to lots of cool places as well, like Central Otago, the west coast, and obviously we can get to those bigger cities if we need to. We have an airport, which you can fly direct to Wellington from, which can be helpful if you don't want to drive to Christchurch. And our region has lots of nice things to do. It's a good spot to be. So as Aaron said before, we are a secondary centre servicing quite a large population of people spread over a big distance. So we are taking people from Ashburton and Oamaru as needed as well now. So we see lots of people.
So I know that Aaron said, we really want to see like your connections to the region, but don't be put off if you have also never worked in Timaru or even like worked in the South Island. Like that was me. I was in Auckland prior to going to med school as well, so I had been there for like 9 years. The only reason I even considered Timaru was because I watched a webinar and I thought it looked kind of cool, so I flew down and met Aaron and got a tour of the hospital. I was pleasantly surprised by it, and I was like, oh, this is actually way bigger than I anticipated, and the town had a lot more going for it than I kind of realised. It's really like a close-knit team. We do a lot of stuff together in and outside of work. I was also the only Auckland grad to come down, but that wasn't discriminated against. And everyone really welcomed me with like open arms, invited me to all the social stuff. We kind of have something going on every weekend. People are going away camping or like hiking. If you're into the outdoors, it's a really good place to be. I've already been to we did a big trip down to Queenstown, a bunch of us. We've been out camping at Lake Aviemore when it was a lot warmer. We're planning all of our ski trips. We've all got season passes to Dobson. Also, one of the boys has a van, so it's going to like take everyone up. We do lots of stuff, like after work drinks and dinner. So like, yeah, very big social group. Still work hard, obviously. We have lots of opportunities for like different things, studying and training wise here. The difference that I found a lot being a house officer here compared to like being a TI in a bigger centre. I was in Hamilton last year, is that I have a lot more hands-on experience here. I did gen surge in my first run, and I have never been to theatre so much, and it was like just me and the consultant, and so they actually let me do a lot of stuff as well, which was really nice. I also got to go to clinic once a week with my like the vascular surgeon here, and I wasn't just in standing around watching him. He would let me see the first patient, like first assessments, and then I would present to him and with my plan. Sorry, I'm also on call. So that was really cool to work through. Do lots of like suturing, do lots of ultrasound, cannulas. The other week we're going to do now they're on med, we're going to do ascites, taps, LPs. So you get to do lots of stuff with the consultants because there's not like a reg in your way. The work-life balance is really good. I'm on 18 hour, I pretty much leave at 4 every single day. When I was on surge, even late for me would be like 5 or 5:30, and everyone is really pushing to get you out on time. And on med, even the people that are on gen med at the moment, is kind of like 5:36 would be like quite a long day, and the person that's on long day would be trying to take jobs off you to get you out. So we have like a big push from all the health officers around us to try and keep everyone out on time, so to keep you sane. It's really cheap to live. I currently rent alone, and I have a dog. I would never be able to do that elsewhere. I also walk to work. The parking is free.
So if you were to come here and work with us, in PGY1, there's 4 different runs that you would maybe get to do one of each, or possibly miss one and do 2 of the other. So that's general medicine, general surgery, geriatrics, or ATNR, which is what Kate's doing at the moment, and orthopedics. And on those runs, you aren't just doing ward-based work of admissions and discharges. You're also going to theatre, going to clinics, and helping as part of the wider MDT. And then in PGY2, you can do the PGY1 runs again if you really wanted to, but there's other runs that you can do as a second year. So that includes emergency medicine. The community placements here at the moment, there's a general practice one, and then psychiatry, and they've newly introduced combining that with palliative care. And then there's also obstetrics and gynecology, pediatrics, and relief. While you're here, when you work a long day, they're split into a medical long day or a surgical long day. Now, the surgical long days actually cover general surgery, orthopedics, pediatrics, and obstetrics and gynecology. And medical looks after general medicine, psychiatry, and geriatrics. So even if you don't get to do a full run in a specialty, you will still get exposure to that specialty even in PGY1. So you might be assisting in cesarean sections as a first year house officer on a long day. So it's a lot of exposure to different things from early on.
So just kind of like a typical day. I mean, on 18R at the moment, it's quite chill. And we have like a morning meeting that starts at 8:15. So I roll in like 5 minutes beforehand and print my list. And I'm generally leaving at 4, and that's Monday to Friday. When I was on surgical, I would be in at around like 7:30 to have everything prepped, and generally leaving like 4:30-ish. The long days and weekends can be a little bit like scarier because you are, like Bodine said, it's like you are the one that's covering. It's one health officer covering medical, one health officer covering surgical, and again, so it's like all the specialties that come under that. However, there are PAR nurses around and ICU regs, and your consultants are on call, or we do have some like surgical registrars who are on call, and you can call them, and like orthopedic regs as well. So it's not as intimidating as you think, as long as you are kind of okay to see where your limit is and then ask for help. Yeah, I've had plenty of times on a long day where I've kind of felt like I've reached the limit of where I'm at. And so I've just like reached out to like the PAR nurses, who call them, and then they come, and you can just have someone else to like bounce ideas off. Yeah, and even the ICU regs. And I mean, in the very beginning when we first started, everyone was also like, feel free to like throw any questions into, we have like a big group chat. They're like, if you're really stuck, just ask, because there's lots of us who are around who will like reach out. Your medical weekend, yeah, you have a long day and a short day. Whereas surgical weekend is double long day, yeah, which can be a little brutal. In the first 6 months, it's the same as anywhere else. You do 10 days on, 4 days off. And then if you change to stones in your second 6 months, you'll do 12 and 2. Night shifts start after the 6 months. And at the moment, we only have 2 house officers on that cover night, and you do both the wards and ED. From midnight, there isn't an ED consultant on, so it is you. There are generally, like I said though before, with long days, there's normally PAR nurses and ICU regs that you can call, and you obviously call consultants as you need. There's like on-call anaesthetists that can come in and help with blocks and stuff like that, and obviously if anyone needs to be operated on, the surgeons come in, and then you'll have to go and assist. Yeah, that's probably the one of the harder aspects of having to Timaru.
Yeah, I think nights is probably the thing that can be most intimidating, but is also where you get the most learning. We have a lot of autonomy here, especially, you know, when you're on a night shift and you're a first year house officer, you can order any radiology in the emergency department without having to get it signed off by a consultant. There's some asides to that, but if someone's got really bad abdominal pain and they're not a child, you can order a CT abdo-pelvis and get those results reported by an on-call radiologist without having to speak to the surgeons. Ordering blood tests and things like that, you can do it all. And you know, there's no senior in the hospital with you, but there's people at the end of the phone if you need to contact them. Something that becomes more manageable as time goes on. Yeah.
And I think it is something that attracts people here as well, because you actually feel like a doctor and not just like you're following people around writing their notes.
Yeah. And the weekends, I think it's quite good that we work 2 weekend days in a weekend. It means that you're not working a weekend every 2 or 3 weeks, one single day. It also means if you do get rostered days off, you get 2 rostered days off, which is much more usable than a random Wednesday during the week. And Aaron's pretty good here most of the time, especially after the second half of the year. Our rostered days off are adjacent to a weekend that we're not working, so get a 4-day weekend, which is pretty good. So in terms of teaching and study opportunities here, we've got teaching every week from the emergency department. They do specific teaching, which is really hands-on practical teaching that's super useful, especially for our night shifts. And then the structured teaching as part of the medical council requirements for having house officers here is each week as well. Sometimes there's 2 sessions, sometimes there's 1 session. They're from a wide variety of people, not just doctors, sometimes physios, dietitians, all sorts of members of the community. Hospice will come in and do teaching sessions with us. It's really useful. There's obviously all the other hands-on opportunities for learning and teaching as well. So Kate mentioned before, you can be in clinic most weeks if you want to be. You can go to theatre if you want to be. Sometimes you need to be. Suture clinic, skin clinics are really good for practicing sutures and taking out minor skin lesions. Like Kate was saying, we do chest drains, we'll do abdominal drains for ascites, femoral nerve blocks we need to get good at because we need to do them overnight, even more basic procedures, IV lines and things like that. There's heaps of opportunity for teaching there. There's courses that are run in the hospital as well. So we keep the hospital will keep you on top of your advanced life support. There's newborn life support here as well, and also Prompt, which is a course to bring MDT together for obstetric emergencies. If you're really keen, you can do some audits of extra research. The medical department and surgical department are frequently advertising spaces or supervisors willing to help with audits. I think if you approach the other specialties as well, they'd probably be more than willing to help you. And then once you get into PGY2, you can start applying for funding and time off to go to other courses like advanced pediatric life support, the trauma courses, things like that, that are helpful for career progression and what you might need to do for whichever specialty you're looking at going into. You can also do the pediatric or obstetrics and gynecology postgraduate diplomas here. I think generally that involves doing a 6-month run in either obstetrics and gynecology or pediatrics, and also signing up through the university. So if you're interested in those sorts of things, the consultants are very happy to facilitate that for you.
So I mean, we've kind of gone over a little bit of this on surgical run. Like I said, you're generally in at like 7:30, prepping everything, and then you round with the consultant. And then it kind of just depends what they have as to what you're doing for the day. For our surgical runs, for say Gen Surg, we have 2 different teams that have 3 consultants each, and you kind of get to know their schedule of what days they've got clinics, what days they've got endoscopy, what days they've got theatre, who's on like acutely. You'll also, when you're on, be down in ED admitting patients as well. Like you can be the house officer that's going down admitting the patient up to the ward. There is still obviously all the classic house officer stuff like discharges to do. That never really goes away. There are lots of opportunities to work with the consultants for research. Also, just in a like general sense, consultants here are really approachable and also want to teach, because then obviously they don't have to come in to do like something that they'd consider like a minor procedure. And medical runs, it's when you're on Gen Med, there's, I don't know, like 5 or 6 consultants on the ward at once, and you'll have handover and then round with them, and it's generally just you and the consultant, plus minus a med student when they're around. Lots of clinical procedures, like I said before, and lots of discharges. One of the bonuses I found actually though is that when you have input into the plan, like it's actually listened to. So your consultant will ask your opinion and actually take on board what you say, which has been quite nice. And you're not just following them around like a glorified med student.
So you probably noticed the pictures on these slides. They're all pictures from things that we've done not at work, aside from one. We touched on this a little bit. There's lots of good ski fields around, and that's a popular activity for all of us over winter. So we're pretty central to Mount Hutt, Mount Dobson, Oho, and Round Hill. And if you're not into skiing but like the snow, we're very close to the Mackenzie country. So Aoraki, Mount Cook, and Tekapo are beautiful spots to go. Lots of us like camping and tramping. There's a picture on there surfing down at Kakanui, just out of Oamaru. That frequently occurs over summer. So we get up to all sorts down here. There's good mountain biking, walks, we've got the beach. There's all sorts that you can get up to.
Yeah, and I think something that might be like a little different here is that we don't just socialise with all the other house officers. Like it's very much the pharmacists, the dietitians, the nurses, like everyone kind of gets involved. It's really quite cute.
Yeah, like you go to the CAP at lunchtime and we'll all be there at lunch at around the same time, and we're all sitting together. It's not like the bigger hospitals where there's the regs and the house officers and the med students. We're just all together. which is really nice.
Yeah, and generally also you'll actually like get lunch.
Yes.
And appropriate time.
Yeah.
Yeah, everyone is, if you're like super slam trying to do stuff, everyone kind of takes care of one another, and it's like, what can I do for you, so that you can also get away to eat.
It's one of the benefits of knowing everyone who's working here, right? Is that we know if someone needs help, there's someone willing to give that.
Yeah. And like on today, all the hubs opened for next year, and like Alex, the pharmacist, was there booking in spots for us for next year. So even though we're at work, he's like, yeah, don't worry, guys, I got you. So it's really nice.
That brings us to the end of our presentation.
That was amazing. Thank you. Really informative, and I thoroughly enjoyed that. I'm sure our participants did too. First question is, what is the quality of the food like at the staff cafe?
But to be honest, that can vary. Some days you're like, oh yeah, this is actually quite nice. And then other days you're like, I wish I'd packed my own lunch.
I guess it's hard because the cafe here is not just a staff cafe, it's also the public hospital cafe. So they're providing for sometimes a small amount of people and sometimes a large amount of people. In general, there's a meat option and a vegetarian option in the hot section, and then there's a variety of sandwiches, toasties, bagels, things like that.
Yeah.
Started getting a sushi from St. Pierre's Sushi, which is a good on-the-go option.
Oh, the line for coffee is never long.
Yes. Yeah.
That's important. No other questions have come through. So just a reminder to our participants that are watching, this is a great opportunity for you to ask any questions that, any burning questions to be answered on the spot. In the meantime, I do have some general questions that have come through that we can go through together. I just see there's one that's popped in, so I'll ask this one first. With such few registrars, is it kind of an expectation that house officers move to other centres when they reach that step? Are there any training programs supported at Timaru?
There's a few registrar jobs here now, so a lot of the house officers will move on if they want to do have some experience in specific specialties, not like some specialties that aren't here, but a lot of people will stay on as well. So you can go on to be an ED registrar here, you could do surgical registrar here, orthopedic registrar, and ICU registrar are the main ones at the moment. And in terms of training, I don't think you can do your first few years of training here, but you can come here on placements during training. Is that correct?
I think they've just changed for Gen Surge. So at the moment, it's 2 non-training registrars. From next year, it's going to be 1 training registrar, 1 non-trainee registrar. Orthopedics have 1 trainee registrar, 2 non-training registrars, and ICU have some training.
7 non-training. It is there are some runs that are like accredited for Royal Hospital training, especially I think ED is the one at the moment, but it's something ICU is working on as well. So a lot of people that are going down the Royal Hospital medicine path, they can do that in Timaru.
You can also do GP training here if you are interested in becoming a GP after PGY 1 and 2. We've got a couple of GP registrars now who were here last year as PGY 2s.
Can you tell us a little bit about what the orientation week will entail?
Yeah, so you do a week prior to the start of Q1 where you're supernumerary. So we have a lot of lectures in there with different services where we can introduce you to like the main services you'll be using in your first year. A lot of the lectures are in the morning, but we're trying to get them to the afternoon so you can spend the morning on shadowing the run that you'll be working in your first quarter, doing handover, and then getting to do some admissions. But a fair amount of that orientation is shadowing a house officer that has been working that run for the past 13 weeks. So you can hit the ground running the week after.
Quite a common question that we've been receiving is wanting to know if the hospital is paper-based or electronic.
I'd say we're a good mix. Yeah. Yeah, we've got electronic medication charting through MedChart, which is really good, and we've got Health Connect South. So for anyone who's worked in the South Island, you'll know about Health Connect South. We have still got paper admissions, but it's electronic discharges. All of our radiology requests and lab requests, radiology requests are online, lab requests are on paper, which is actually quite handy because you can just tick another box if you want something that you forgot to put on.
All patients, like inpatients, still have like a paper record, which can be helpful when you need to go back and look at past history.
Also just something different from like the North Island. So Health Connect South. So we can see all of like Christchurch's discharge and Dunedin and everything, which isn't the same as when you're in, like when I was in Hamilton, I couldn't see Auckland stuff. So that's quite nice.
Health Connect South has all of like GP referrals, which are really useful for getting past medical history. All of their outpatient clinic letters.
You can see all their meds, all their lab passes,
previous radiology reports and lab tests and things.
Also just a random aside, radiology stuff gets reported really quickly here. So, if you're worried about ordering something on a long day and having to like read it yourself, generally things get reported late. Even chest x-rays for like placement of NGs and stuff mostly get reported same day.
We're really lucky here with the radiology that we can request. So I've ordered an MRI for a patient who's in ED on a Friday afternoon, and it's got done and it's been reported and the patient's been sent home. I don't know if there's anywhere else in New Zealand that would happen.
And even like ultrasounds, and you order it that morning and it happens that day.
There is another question that's popped in the box, so let's go for that one. Do you think this is a good place to work for someone interested in a surgical career, and does it set you up well?
I think so. And as someone that like didn't really think that I even liked surgery, I've had such a good time. Really good for getting like a lot of hands-on experience, like I said, in theatre and with clinics and with consultants. I think that some people are really worried about like, but my face won't be seen by the consultants that are like on the ones picking for the training program. But our consultants have a lot of ties with like people in Christchurch anyway, and B, it's kind of like your own CV that you're applying for. You can still do research here. You're going to do a lot more time clinically actually doing stuff and admitting and seeing stuff.
And although we've sort of said that we've got general surgery, they're very general surgeons, so they still do a lot of bowel and upper GI stuff, but there's breast, there's thyroid, vascular. We've got ENT surgeons here as well, and they're happy for us to go and watch in theatre or go to clinic if we've got the time to and are interested. There's also
urology as well. Also, and if you like ortho, the ortho house officers last time were in theatre so much. And like their regis would text them to be like, we're doing this like relocation down in ED, do you want to come? And like stuff like that. So people will get you involved, and if you show that you're keen, then they'll like really take that on board.
We have another question. Is Timaru supported by Christchurch or Dunedin consultants in specialties that Timaru doesn't have access to?
Christchurch.
Yeah.
A prime example is like infectious diseases. We ring them relatively frequently if microbiology can't help us. Oncology, most of it, it's done as outpatient in Timaru, so we've not got an oncology or hematology ward for inpatients, so they go up to Christchurch, those sorts of things.
And any kind of like neurosurge or urology transfers or anything, everyone goes to Christchurch.
If there are any further questions that you might think about once the webinar has ended, you're more than welcome to contact Aaron directly. The details were provided on the presentation, but also, as he mentioned, they are available on the ACE RMO website, so feel free to get in touch. And then if you have any questions with regards to the ACE process at all, you can contact me directly. My details are also available on the ACE RMO website. On that note, I just wanted to check with our panelists if we had any final last comments. Just a big thanks from me and from ACE today for your time. I know, as I mentioned, it's very valuable, and I hope that our participants enjoyed. I'm sure that they were able to gather a lot of information that was shared today. Just a reminder for our participants to share with their colleagues and friends if they weren't able to join today's live session. This will be uploaded to the ACE RMO YouTube channel. This normally gets uploaded within a few days, so keep an eye out there for it. And then also just another tip to keep an eye out on the ACE RMO Facebook page. There's quite a few tips and updates that get posted up there on a regular basis. So a good idea to go and like that page and have a look.
Kia tau te manaakitanga, kia ronga, ki tana o tātou, kia piki te ora, kia piki te maramatanga, kia hoki pai atu, kia hoki pai mai, te tūru whakamau, kia tina, huie, tākia. Settle the care and protection upon each of us. May the health and understanding grow. Return well to others and ourselves. Hold fast to your authenticity. Be firm, join together, gather together, bind as one.
Great, thank you so much, and I hope everyone has a lovely evening. Cheers.
Thanks, everyone.
Bye.